Hello, everyone. Welcome. My name is Susan Reyna Guerrero. I'm President and CEO of Beacon Therapeutic. I'm here today with Joe Africk, President and CEO of the Respiratory Health Association. I'm representing Beacon Therapeutic. We've been in existence since 1968. We are a multi-service organization located in the Beverly area, and we have a therapeutic day school. We provide outpatient mental health services as well as mobile shelter outreach services program. I'm going to put some information on Beacon and our different locations. We have 4 different locations. We have our business office that's located in Beverly on 103rd and Longwood. We have our homeless outreach services that's located on Western, our Longwood campus on Longwood Drive, and our Calumet Park campus that's on Ada. Beacon actually was founded by a number of parents in 1968 who were desiring to find special education services for their children. And since then, we've really evolved to respond to the multi-needs of children and families within the city of Chicago. We're particularly pleased today to have Joel Africk here because this really signifies for Beacon a new opportunity for us and something new that we're able to provide to our families in terms of some wonderful access to wonderful resources for our families. So maybe before we go into the actual initiative, maybe Joel, you can tell us a little bit about yourself and how you got involved with the work that you're doing through the Respiratory Health Association.
Okay, well, Respiratory Health Association has been around for 106 years. We started just after 1900 when the nation's biggest health worry was influenza and tuberculosis. Since that time, as the health needs and the lung health needs have changed, we've responded to the problems of childhood asthma, and we've responded in a big way to the problem of smoking and tobacco-related illness, which is really the number one preventable cause of death in the United States today. Myself, I was a volunteer, so be careful out there before you volunteer. It may just take shape. So I was a volunteer for several years and ultimately left my practice of law to become the full-time president and CEO of Respiratory Health 9 years ago, and it's been great.
I think, as I mentioned in the beginning, in terms of Beacon Therapeutic, we were successful in being able to apply for a grant to the Respiratory Health Association, and it really signified for us an opportunity. We've always tried to meet the needs of our children and our families, in terms of housing, in terms of their mental health needs, and probably the past couple of years we've really branched out into responding to health education needs of our family. So to that end, we secured a small public health grant through the city of Chicago to meet those needs. But I think particularly we were able to apply for funding through this new grant that was made available, and it's $11.5 million through the Department of Public Health and the Respiratory Health Association that was awarded by the CDC. Can you tell me a little bit about that funding opportunity? Because I think it's a significant amount of money that translates into a significant amount of resources.
Yes, thanks, Susan. The American Recovery Act, part of the stimulus package, reserved a certain amount of money to fight the 2 biggest public health threats that we face today, tobacco and childhood obesity. Respiratory Health Association was fortunate to receive a large grant, $11.5 million, to work on a citywide project with the Chicago Department of Public Health, focusing on how can we lower the smoking rate among adults, how can we lower the smoking rate among our youth, and what can we do to increase the number of smoke-free environments that we have throughout the city. So that's our focus. And our approach has been really to focus on the populations within Chicago that smoke at the highest rates. We know that Chicago's overall smoking rate is a little bit higher than the national average, but specifically among the mental health population, among the substance abuse population, among the homeless, the lower socioeconomic groups, smoking is a real problem. And that's not just an economic problem, that's a big health problem. And this is a 2-year citywide effort to work with organizations just like Beacon Therapeutic to get the message out to these vulnerable populations to help them become tobacco-free.
I'd like to remind everyone that this is a live call-in show. If you have any questions or comments, please feel free to call. The number is 312-738-1060. Again, Again, my name is Susan Reyna. I'm President and CEO of Beacon Therapeutic, and I am here today with Joe Africk from the Respiratory Health Association. You were mentioning some of the populations that are targeted in this initiative, and Beacon in particularly was targeting homeless families and homeless moms and our special ed population within our therapeutic day school. In terms of some of the programs that Beacon operates, we do have a special ed program where we're working with inner city youth, providing special education services, and we're also one of the largest providers of mobile mental health services. And as such, the grant that we've received from through this funding opportunity really is working with families within the homeless shelters, providing a myriad of services to them, but also providing education to our day school students.
Yeah, our thought at Respiratory Health Association is we know about tobacco and how to help people quit smoking. Groups like Beacon Therapeutic know more about the specific populations that you work with on an everyday basis. So if we could team up with you and help your organization work with your population that you already know, that would give us a big chance for success in this program.
And now this is we're entering year 2, right, of the
Yes.
funding. What are some of the outcomes that you have found thus far?
Well, there are a few ways that we're measuring our success. One of the ways is that we've been doing a lot of television advertising and asking people to call the Illinois Tobacco Quit line, which is 1-866-QUIT-YES.
And I'm going to actually put that on for individuals who would like to call on that.
So what we've been able to find is that when we put the right commercials on TV promoting quitting smoking, that a number of people are calling the quit line. And in fact, the calls to the Illinois Tobacco Quit line have more than doubled since we started doing our advertising.
Mm-hmm. And I think that's something that, I feel like you're everywhere, which is great. And I think that's really important because I think the more visibility you get, the more people will see that as something that they can easily do. Apparently we have a caller. Caller?
Yes, hi. I am very impressed with the collaboration, but I'm wondering for this population, how do you continue this education on so they don't go back to smoking? What is the long-range follow-through with the program?
Well, it's interesting. Thank you for that question. We were talking about this a little bit earlier in terms of how do we continue to support the work. We talk about sustainability efforts. The grant that we have is a 2-year grant, and I think, do you want to mention a little bit about some opportunities that will continue?
Well,
what we're looking for.
Some of the things that we're doing are trying to change policies and systems and environments to help achieve our objectives. So, for example, Beacon Therapeutic is adopting smoke-free campuses at its 4 locations. When Beacon Therapeutic makes that decision, even though the grant money will run out in about a year, presumably they will not go back to allowing smoking at their facilities. So that's something that's kind of automatically sustainable. The other part, though, that requires a little bit more work is reaching out to Beacon's funding sources and other funding sources in the city to say, this is a comprehensive approach to health that is changing lives and we think should be incorporated in your regular work.
Mm-hmm. Well, and I think, you mentioned that, I think one thing that's been so great for us to work with you is that I think you get carried away with the momentum. And before I knew what I had said, we were going to go smoke-free in our campuses. And we do have 4 different facilities, and we work with children that can be very challenging. And I think, stereotypically finding smoking as a release is something that people have engaged in. And I think this is something that if, we can clearly do this, it's a wonderful role model for our children to be able to see the staff not smoking and engaging in these healthy behaviors. And also it's a role model for our adults that we work with as well.
And your locations are a zone of wellness.
Yes.
And a zone of health. Mm-hmm. And the idea is that we should be doing that not just at Beacon Therapeutic, but actually in Chicago. Stroger Hospital is now a smoke-free campus. Rush, Northwestern, University of Chicago. Some of our community hospitals have adopted smoke-free campuses. And the more we can do that, the less reminders there will be, the less examples there will be for the children. And I think overall we're going to see an improvement in our public health.
And one of the things that I know we're working with is particularly our work with the homeless shelters is trying to get them on board also to see this within their homeless shelters to move to a smoke-free environment. But I think, it's providing education. So maybe describe what are some of the supports that organizations can look for in making this transition?
Okay, Respiratory Health Association has a quit smoking program. It's called Courage to Quit, and we developed it with a very talented researcher, Dr. Andrea King at the University of Chicago, who's an addiction specialist. And this is a program designed to be offered in a group setting to help people who want to quit do so. There may be some smokers who right now do not want to quit. The statistics are, though, that 70% of the smokers will tell you they want to quit, and 50% of the smokers will tell you they've tried. So our focus is, how can we help the people who want to quit decide to try, and how can we help those who are trying to quit be as effective as possible? And what the research has shown is that it's not always the most effective to say that's it and put down the cigarettes and try to quit cold turkey. That may work for some people, but for other people, having a group that they can go to every week over a 6 or 7 week period is helpful. Knowing that there is nicotine replacement therapy, either a gum or a patch that can help fight the chemical addiction while you're working on the behavioral. So these are some of the things that we work on right now.
And I know there's the really neat initiative, that Operation Storefront, that I love to hear about. And it's kind of the youth piece to it, which I think is wonderful for our kids.
What we have found with children, and this is true around the country, is that they don't want to hear us say, don't smoke, it's bad for you. What kids would rather do is learn the facts for themselves and then make their own decision to quit smoking. So Operation Storefront is a program that invites children to learn more about how tobacco products are sold so they can make their own decision, which we hope will be a smoke-free decision.
Yeah, I'd like to get back to that, but we also have a caller. Caller?
Yes.
Yes.
In today's newspaper, the state of Illinois has decided to start regulating smokeless cigarettes. Would these ever be introduced into the homes of these people?
If you're talking, it's a good question. If you're talking about what is sometimes called the e-cigarettes, which are kind of the water vapor cigarettes, the Food and Drug Administration has not evaluated that product, although the FDA has invited the product to be submitted for evaluation. There is no evidence right now that those products are actually part of a quit smoking strategy, and we don't really know yet what all the harms are. If I can give you an example from maybe 30 years ago, when light cigarettes came out, there was a cigarette that they said, this is for the health-conscious smoker, and it's lower.
Is there such a thing as a health-conscious smoker?
Well, the tobacco industry found out there was, and they said it's low in tar and low in nicotine. Well, at the same time, there was research that showed that smokers of these light cigarettes unconsciously drew them deeper into the lungs in response to smoking a light cigarette, and it's actually been linked to all sorts of bad things, and that's why light cigarettes are now banned. So before anybody jumps on the e-cigarette bandwagon, what the FDA has said is it would be great to see some proof.
No, that makes sense. Well, I think it's people trying to find alternate things to maybe support that, but I think there are clearly some better options in terms of the patch, in terms of the gum, to really reduce the dependence on the nicotine and those other harmful effects.
And there are some prescription drugs too. Now, not everybody has access to prescriptions. Not everybody feels comfortable taking a prescription, but drugs like Wellbutrin or Chantix, which came out just a few years ago, have reported a lot of data about being effective. So if we know there are things like group classes and nicotine replacement therapy and Chantix and Wellbutrin, why go off with hypnosis or laser or e-cigarettes and some of the strategies that just haven't been proven? I'm not saying it doesn't work, but they're unproven
at this point. Now, we were talking before the call about this Operation Storefront, and I think some of the pieces that I've seen, it's these kids really get into it. They go in with the video cameras and they're talking about the marketing. I mean, I know there's some other funded entities that are doing some of that work, but are there some neat anecdotes you can tell us? Because I mean, I know some of the stuff that I saw was pretty neat, I thought.
Well, the idea of Operation Storefront is that there's a curriculum that goes with the class, and the kids go off and do field assignments. And that may mean walking into the local corner store and taking a look at the wall of tobacco and noticing whether the pictures are all glamorous and colorful and kind of enticing. And then they write it up. And as I said, we're trying not to wag our fingers, and we're trying not to tell the kids to quit because their parents say so. We'd rather have them discover this for themselves.
Yeah, and I know, and I think that is the best way to engage the kids. And I know it's the best way to engage our youth is, you're right, telling them it's going to draw them to it some more. Now, I do know this initiative also has some policy pieces to it. Maybe can you describe a little bit about the policy work that's part of?
Okay. Some of the policy projects that we're working on have been enacted in other parts of the country. In Chicago, for example, the Chicago Park District has already decided that beaches should be smoke-free, but we're not doing very much to remind people of that. So one of our policy efforts is to work with the Park District to better communicate that at beaches and play lots, we shouldn't be smoking. It's bad for the kids, it's bad for the people who do it, creates a lot of litter, and that's now a policy. And we're working with the Park District on other things that can help achieve the same goal. We're working with area hospitals to adopt smoke-free campuses. We're telling them, be just like Beacon Therapeutic. You can do it. We've been looking at the state level with other groups at the proposed increase in the cigarette tax. There's a lot of evidence that when you increase the cigarette tax, particularly kids quit smoking. You have fewer youth smokers. About every 10% that the overall price goes up due to a tax increase, the youth smoking rate drops by about 4 or 5%.
Wow.
The adult smoking rate drops a little, but it's really the youth that we're focused on.
Gosh, that's great. What other statistics are relevant for us to understand in terms of the impact of smoking in Chicago, health outcomes? Okay,
there are a few things. In Illinois, we now have a great smoke-free law. Smoking is not allowed in bars, restaurants, casinos, sporting facilities, in a lot of other places. That's great, and that will pay off in the long run in less lung disease. In the short run, it should mean fewer asthma attacks and actually fewer heart attacks. There are experiences, because, and I'm not a scientist, but secondhand smoke contains tiny particles. You may not see them, but it contains tiny particles. And secondhand smoke has been linked to heart attacks, myocardial infarctions. So in the town of Helena, Montana, for example, several years ago, Helena passed a smoke-free law. The surrounding area did not. What they found was that the number of heart attacks in Helena went down by double digits, and in the surrounding area it didn't go down. Then a court invalidated the Helena smoke-free law, and they went back to allowing smoking. And you know what happened to heart attacks in Helena? Went right back up to where it was before the smoke-free law. That's been repeated in some towns in Colorado, in New York, in Scotland. So actually, even though we're the Respiratory Health Association, heart attacks are one of the first things to go down after you have a smoke-free law.
God, that's amazing. And I suppose the impact, I mean, this is hard evidence. This is very positive health outcomes. And so the difficulty in people ceasing to engage in these activities, it's more access to the support. And I think when we look at what this initiative has done, has really provided that extra support for folks who maybe do want to quit.
That is so true. Yeah. We know it's hard to quit smoking. Many people try 2, 3, 4, 5, 6. My staff told me today the average is between 7 and 10 times before they can actually quit for good. We want to try to make every quit effort as helpful, as nurturing, as productive, and as successful as possible.
And I think that's, again, for Beacon, being able to access this funding really has been able to, further the opportunities that we can provide for normally families that are very disadvantaged, that don't have access to a lot of resources. So again, for our youth, that's been really great to be able to offer that education and training. And then, of course, for our staff, so that they can be good role models. And then, of course, for the folks that we work with in the homeless shelters.
Can I ask you, Susan?
Sure.
I mean, what's been the biggest surprise in the year that you've been working on this project?
I actually think the biggest surprise is the willingness for individuals to engage in this level of discussion.
Isn't that something?
And I think it's, when you ask people, what's the biggest thing to get people to help, you just ask. And so it's the same thing. What's the biggest thing to help people to stop smoking? Just ask them, are you ready to stop? And I think being able to offer this other set of resources to our families has been very powerful for us, because we've always discussed things like, how's your housing, how's your mental health, are you taking your medication, how are you doing with the parenting for your children, are your children accessing the services they need. But being able to really talk about smoking per se, and their desire to want to live a healthier lifestyle, and then providing the support for that, I think has been very helpful.
And and that's exactly what we're seeing throughout the city with all different populations. And I think that's in part because our partners, our community partners, are helping organizations. Like I said at a meeting a couple of months ago, we're not looking for people to just move around the papers. We're looking for people who want to join us in this historic effort to really change our smoking rate. And I think that's what we found, not only with Beacon, but with some of the others. And we've really been able, and our partners have tapped into the fact that 70% of the smokers really do want to quit. So the question is, how can we help them?
Yeah. Well, and I think this opportunity has given us to have the tools to
That's
do
great.
that, which is great, which I think has been very helpful. So where do you see the long-term ongoing work for this? I mean, this is a huge infusion of money, huge infusion of media and so on. So what happens 3 or 4 years from now? Yes, Beacon will still be smoke-free. And, we will continue to offer, the support, but this level of dedicated support, where do we go with it?
Well, we're going to try to do everything we can to keep this effort alive. We're working very closely with the city's health department. City's got a great health department, and all of our partners to really help this effort to continue. Respiratory Health Association has been working on tobacco control and helping people quit smoking long before there was an American Recovery Act back in 2009. It's a lot easier to do when there's a lot of funding, but that's something that's just part of our fabric. So we're going to continue on. We're working a lot now on encouraging people to have smoke-free multi-unit housing. We've started to see in Chicago townhouses, condominiums, and apartments recognize that if your next door neighbor smokes, that's a little bit like you smoking too. And that effort is just beginning to gather steam now. Our approach there is not to pass laws prohibiting it, but to let the forces of the marketplace take over and offer more and more smoke-free multi-unit housing.
Well, thank you very much for joining me today. Again, I represent Beacon Therapeutic Diagnostic and Treatment Center. I've had the pleasure of having Joe Africk here, the president and CEO of Respiratory Health Association. Very grateful for you being here and grateful for the funding, and we look forward to working together ongoing.
Thank you so much.
Thank you very much.